with a single apical foramen is an exception rather than the rule. Okay, we can classify curved canals into a lot of classifications. One of the simplest classifications are Schneider classification. He classified the curved canals into straight, less than 5 degrees, like this case, moderate from 10 to 20 degrees, like this one, and severe curvature more than 20 degrees, like this one. Okay. How to diagnose a curved canal? Number one, clinically, by the shape of the initial file after the removal from the canal. When you insert the file firstly in the canal, it will take the shape of the canal. It is preferred to be a smaller size file which took the shape of the canal. Okay. Number two, radiographically, by taking a mesial and distal shift or mesial distal angulations, not a single angulation. As you see in this case here, you can see by the cursor here the distal root shorter, okay, by a distal shift. When I talk the mesial shift, oh, it is a very curved root apically. So shift here or multiple angulation is very important in diagnosing the curvatures of the canal. Okay. Also, the cone beam CT here is the best one to identify the curvatures. What are the difficulties in management of curved canals? Difficulties in cleaning and shaping and obturation. As you see here, there are very excellent motors from Coxo. You can use it. Here, an ideal root canal preparation is one in which the original canal morphology is maintained during the preparation procedure. It is a very, very important rule, and it is an objective of your cleaning and shaping procedure. An ideal canal preparation is one in which the original canal morphology is maintained during the preparation procedure. So you must preserve the canal anatomy. Okay. What are the potential risks in management of curved canals? Number one, transportation, as you see here, a ledge, perforation, instrument separation. Okay, let's go to the procedures of management of severely curved canals. Number one, the axis cavity. Your axis cavity must be a straight line axis, to reduce the stresses as much as possible on the files. Okay. Number two, scouting, which means the use of small files passively for scouting without attempting to reach the full working length. Using small files. Do not use large files, as they may cause a ledge. Okay. Third, coronal flaring. It facilitates the direct access into the middle and sometimes the apical canal fit. Coronal flaring facilitates the preparation of the remaining of the root canal. Number four, the glide path, which is a very, very, very important step, which means creating of a smooth radicular tunnel from the orifice of the canal to the physiological terminus of the root. It is the most important step here, the glide path. We can do it manually by manual files, 10 and 15 and 20, or by rotary files like the pass files from the supply. Okay, the crown down technique, number 5. Advantages over step back. The crown down technique here is very, very important. When you use the crown down technique, you reduce the stresses on the files. You created a room for the irrigant. You can also increase your tactile sensation, especially in the curved canals. Okay, number 6, patency, which is an important step also. Patency means pathing by the file 10 beyond the apex by 1 millimeter after each file to remove debris to avoid blockage. Okay, the motion. The most common motions are rotation and reciprocation. Which is better, rotation or reciprocation? Reciprocation is better as it decreases the cyclic fatigue of the files, improves debris removal, and maintains the root canal anatomy. Number 8, continuous irrigation. The use of continuous irrigation using the sodium hypochlorite and lubricant by the editor gel after each file facilitates the management of curved canals. Do not work in a dry environment. Number 9, the apical size preparation. As we know, in the stainless steel files, when you go larger by the file, the flexibility decreases. Also by the night-eye instruments. When you use large night-eye instrument, the core of the file increases and the flexibility decreases. And the chance for risks such as canal transportation or ledge or perforation increases. So it is recommended that your apical preparation of the curved canal is suitable, not small, not large. How can I justify between the apical preparation and disinfection? In severely curved canals, you can use up to file 30 or 25 with a taper 2 or taper 4. Do not use the taper 6 or the larger tapers that can cause ledges or transportation. So the apical preparation here is minimal. How can I increase the disinfection? You can increase the disinfection by activation of the irrigant, either ultrasonic, sonic, manual dynamic agitation, and so on. Okay? Let's say them all. Number 1, the straight line axis, scouting by small files, coronal pre-flaring, glide path, either manually or rotary, the crown down technique, not the step back technique, the patency, the motion, rotation versus reciprocation. Reciprocation, we said it is better, continuous irrigation, and suitable apical size preparation. Okay? Okay, here we managed the cleaning and shaping procedure of the severely curved canals. What about the obturation? The obturation techniques are cold lateral compaction, warm vertical compaction, and biceramic sealer with single cones. Let's discuss the obturation. What about the cold lateral compaction? Let's see this case. This is my case, which when the post of the year in our excellent group, excellent in endodontics, and when the post of 2020, it was a case of a severely curved canal, mesiobuccal canal. It was very difficult. I used a controlled memory files in a reciprocation motion. Regarding the obturation, using cold lateral compaction by finger spreaders here, the spreader cannot go here. The spreader cannot go here in the curvature. So your master cone here will be alone with the sealer. Okay? What about the warm vertical compaction or the continuous wave of compaction? Your pin, when you cut the master cone and down pack it, cannot go through this curvature and can stop here or stop here. So your master cone already will be alone with the sealer. What about using the biceramic sealer and single cone? As we said in the cold lateral compaction and continuous wave of compaction or warm vertical, the single cone here will be alone. So it is recommended to use a biceramic sealer here, for better sealing along the cone. Okay? It is recommended to use a biceramic sealer here, as cold lateral compaction and continuous wave of compaction will not seal this part efficiently. Okay? Got it? Okay. This is another case of severely curved wisdom tooth. As you see here, the master cones and the obturation. I followed the steps I mentioned, the 9 steps I mentioned in my slides. It will